Welcome back, viewers. This is Health Up Show, and all we aim at is empowering us with information, with wealth of information and knowledge, and of course, changing our, what we do every day, our attitudes, and bringing in new skills if that's possible through this particular show. And we have our guest tonight, Eunice Masharia, who is a reproductive health expert, and we are glad to have you, for this particular show. Kindly share on your, social platforms, social media platforms. You have some people you can invite on Facebook Live, others you can tell to watch us on YouTube, and WhatsApp you can be able to send the link. Let's gather together as we get all this, because this is beneficial to all of us. It's a family affair. It's not necessarily, a specific or a particular age group, but all of us can benefit from this particular program. And we believe that's what is happening. There's a number that is going down on your screen. Kindly, you can send an SMS with it. You can also leave a comment and be able to tell us how this is benefiting you, or what kind of input you probably also have. Thank you very much. Let's go back to to what we were discussing before we went for the break.
Yes.
And we were looking at issues. You're just bringing in some basic definitions and some basic understanding of some of these terminologies.
Yes.
And we were looking at menstrual flow, and how many days does this happen, and giving us the variations and these kind of things. And we were at that particular point where we were saying that this menstrual flow happens over a couple of days, and it's going to stabilize, for lack of a better term, over time. And not everyone loses, or the flow is basically not the same between one individual and the other one. Before we move from that and probably look at how does this happen, what is the normal physiology or the changes that bring about this menstrual flow. A question here is there something that you can point out, maybe one or two, is strange or is not normal in terms of the flow? For example, does the flow, what number of pads is one expected to use in a day? Does it come out in clots, or is just in liquid form or non-clotted form? Are there some of the things that we should be careful about, or we should observe, and that should raise an alarm if a particular person or individual experiences such?
Okay, thank you so much. And I think I will start. We have said about the menstrual, the menarche, that's the starting of the menstruations, and have talked about the flow and the number. But as you're asking whether there's something that would bring a concern, one of the things that I would highlight that would bring a concern is when a young girl gets to age of 16 years and has not received her menstruation.
All right.
So we said that there are some who may receive as early as 8 years. Of course, most of the parents get very concerned when they see their young girl having menstruation at 8 years. Maybe because you got at 12, you're thinking that's the way it's going to be.
Exactly.
But again, we also have this smaller number that may not experience their menstruation. So if someone has not experienced their menstruation by the age of 16 years, then you may need to have some medical concerns and seek for medical consults. Yes, because there could be several causes that are happening, and maybe we may need to check out why have this person not received their menstruations. And of course, I know that would leave our viewers with a question like, what are some of the causes? So if you allow me, I can briefly mention some of just a few.
Okay, fine.
That may cause absence of menstruation at that particular age. Sometimes you may have some congenital abnormalities.
Oh, right. When you say congenital,
like something went wrong during the formation of the baby. And maybe they don't have even the uterus. That is why it's not good to ignore. Or they may have it, but something has obstructed the vagina. And all those things can be checked in, especially when there's an obstruction. Some of them, remember we are talking about it's cyclic. They may be having their menstruation, but it's not flowing out because there's an obstruction. Yes. So at that point, if you go to 16 years, and you have not received menses, it is a health concern.
It's a health concern. So we are saying there's no exception. I mean, as long as this is a girl or this is a lady that is transiting on into adulthood, and for me from childhood through teenage, through to adulthood, there is no exception. I mean,
we expect that to happen.
We expect that to happen.
If it doesn't happen up to that age, then we need to find out
we need
why.
to find out what is happening.
Why? Yes,
what is happening. And of course,
Yes.
I think the other messages we're sending is that the earlier the better.
The earlier the better.
As soon as we have these particular concerns,
Yes.
and we are seeing that this child or this lady is not going as it's supposed to.
Yes.
It's not something to shy off.
Yes, it should be.
I think we'll be, at some point to come to some of the needs and all that. So it's something that we should basically, ask for help advice about.
Yes, yes.
All right, that's very good. I think the other thing that probably we need to also allow, because when you say there's no exception, and this is normal, it's part of life, it's part of what God designed,
It's
for
physiological.
it. It's physiological. What is this that basically brings these changes? I know earlier on we talked about about hormones, and how in the hormones, and you mentioned one or two hormones that basically affect or bring these changes or these issues into this particular person.
Yes.
So what are can you expound more on the physiology or the physiological aspects for menstruation basically to take place?
Okay.
Yeah.
Maybe what I would say is, as the stimulation of the hormones, and there are different organs of our body that helps in production of those hormones. Because we have some on the hypothalamus.
Okay. Hypothalamus
it's an organ within the head or the brain.
Within the brain.
Within the brain.
All right.
Yes, and it plays a role in production. We also have the ovaries. We also have the pituitary.
Okay, so you're saying there is
pituitary gland.
There's a cyclic, they sort of these glands, work, together. You mentioned a gland or a particular structure which is in the brain. Then you're talking about the which is
also in the brain,
and you're also talking about the ovaries.
The ovaries.
So all these have their own roles.
Yes.
Okay.
Yes. Yes. They form an axis, and that is which one hormone produced. Like we have the luteinizing hormone, follicle stimulating hormones. So and they they are synergized by production of the estrogen and progesterone, which are being produced by the ovaries. So the level of the estrogen or progesterone produced in the ovary is what determines the action of follicle stimulating hormone or the luteinizing hormone.
All right.
Yes.
Okay.
Yes.
So
there's a synergy there.
All right,
Yes.
Our viewers, we are mentioning very difficult terms, but don't be worried about them. We are basically saying there is an access, or there is actually a working together of all these particular hormones or chemicals that are within the body to be able to bring up this process and for it to become normal. So in other words, what you're also saying is that if this does not, go as expected, there are probably problems in all these structures.
Those structures could be having an issue.
These structures could actually be having an issue.
Yes.
And these are the things that the doctor is usually interested with in terms of looking at where the problem could be,
Yes.
and what could be the problem, what could be happening, and how to solve,
Yes.
this particular problem.
Yes.
All right.
Yes.
Now, the other question that also arises when you talk about these, normal changes, talking about hormones, other than, us, for lack of a better word, just sitting down and waiting because that's natural, and that's what is supposed to happen. Are there other inputs that probably will bring this process? We have talked of, earlier on, of early menarche. But in terms of delay, are there environmental issues that could also make them to delay their menstrual flow, to delay, or their menstruation of this, or this normal physiological pattern for it to delay?
Yes, when you look at the issues like what we have said in hypothalamus, hypothalamus is mainly affected by our environmental factors a lot. You find like these persons, the people who exercise a lot, the athletes, even when they have already started their menses, they can get to a point where they're not getting their menses.
Okay.
But because they have burned a lot of their fats.
A lot of their fats.
Yes.
Yes.
So for the period menstruation to start, we require about 17% of the body fats.
Okay.
The required body fats. For it to continue again, you require about between 15 and 20% of required body fats. So when that is missing, you may find some people get delayed to start their menses, maybe because of those factors. And you may find people who have had their menses also getting absence or delayed, and especially because they have, especially those who have stress, chronic illnesses, you find them missing their periods, but just because of the effect on the hypothalamus.
Okay.
Yes.
Right.
Yes.
Right. When you say fats, is there a simpler way of also understanding it, how the fats probably just mentioning, does it affect hormones or does it affect?
Yes, it also has, it affects the hormones.
It affects the hormones.
Yes.
So that's the relationship that you find when you talk about the arthritis,
Yes.
high activity, people, delay and all that. All right.
Yes.
We are at Health Up, and we believe that this is also helping us and helping all of us as a community. And as we begin and as we continue on to bring in, public health information and how to empower ourselves and to power the lives of society. You can share this, on your social media platforms, and there is an SMS line or there's a number that's going down on your screen. Kindly use that, as this evening we are able to, learn more about, menstrual health with our guest, Eunice Mashari, who is a reproductive health expert. Now, what probably would also want to move on and be able to understand is when we say, that there is a normal physiological way that this menstruation is supposed to occur and to follow. Are there some abnormalities which probably would say they are more or less primary or they are, basic, in other complicated language, call them pathologies that you'd want to talk about in terms of menstruation, not necessarily the diseases per se, but are there some of them that you want to bring them out? Probably, okay, maybe I could pose this to you.
Yes.
Sometimes we find, in practice, some of these young girls coming, they just started their menstrual periods and they're having a flow. Sometimes it's very painful.
Yes.
Are these things normal? Sometimes it affects even their going to school, some of them. So they have, they have loss, of days to school. Of course, it's going to be affecting their performance. And their parents are getting, or they get concerned because they are real parents. The heartbeat of a mother, the heartbeat of a father is when, the child is there and you want to give the best and you want to, whatever problem they have, you want to solve it to the best of your knowledge.
Yes.
Some of it you want to, have the health provider approach it or address it. So are there some of these, like, painful flows and maybe some few others? Would you want to, bring them, and how do we go about it?
Okay, thank you so much. I think I start looking at what you had asked me earlier, the physiology.
Yes.
And I say we have 3 phases of the menstruation. Like once the first day when the period starts, it becomes a genesis over the next cycle. And the first cycle, it takes like half of somebody's normal cycle. In this case, let us use 28 days.
Okay.
So the first 14 days, we have what we call a follicular phase.
A follicular phase.
Yes.
Okay.
And that is when, after the release of the periods or the menstruation, the body starts preparing for a maturation of the next viable egg. Then it matures in the middle of the cycle, that is by about the 14th day, a phase that we call ovulatory or ovulation phase. And this is very important, especially when it comes to issues of pregnancy, because the eggs start now. Many eggs mature, but eventually there's one that becomes dominant, and it's the one that matures at the mid-cycle. And that's what we call at the point where we talk about ovulation. Then we have the third phase, or what we call the luteal phase. So after ovulation, if there is no fertilization, then what will happen is that the body had already stimulated some hormones. The uterus had prepared to receive a baby at the point it was getting to ovulation. And there are a lot of blood vessels and everything that was preparing the uterus to receive a baby. So when it has not received a baby, in the luteal phase, then most of the hormones start now withdrawing because those hormones were meant to support a pregnancy after conception at the point of ovulation. So when that does not happen, eventually the body now starts withdrawing those hormones. And that is how we end up with a menstrual flow. Because once it has not, the hormones are fully withdrawn, then you find whatever had been prepared to receive a pregnancy, the endometrium had already prepared a lot of blood vessels and all that, and that is shed off. And that is what come out as menstruation. Not an egg.
Not an egg. And in that case, you're saying menstrual flow is only going to be happening. I know you're in the middle of this explanation, but the menstrual flow is only going to be happening as long as there's no pregnancy that has taken place.
Thank you.
So we don't have pregnancy and menstruation happening at the same time. It's only that this menstrual cycle goes through these phases. You have talked of follicular phase, whereby a follicle is released, you're saying of ovulation,
Yes.
which, sometimes we want to refer it as, the unsafe days, in terms of pregnancy.
Yes.
In terms of when someone wants to get pregnant, well, those are the good days in that sense. And then we're talking of the luteal phase.
Yes.
And after that phase, if there was no pregnancy, no fertilization, there was no fertilization, meaning there's no pregnancy, that's when menstruation is going to happen.
It's the endometrium is shed off.
Endometrium is shed off.
Yes.
All right.
Now I get back to your second question.
Yes.
And when this happened, I'll dwell on this young person because we already talked about the adolescents.
Okay.
One of the things that happens to them, there's what we call premenstrual syndrome.
Premenstrual
Syndrome.
Okay, so there's there's menstrual.
Yes.
The syndrome bit.
The syndrome bit,
Sure.
it's the syndrome. Pre is something that comes just before
Exactly.
menstruation.
Yes.
And the word syndrome, it says it's a number of symptoms.
Okay.
So the number of symptoms that people experience, what you call premenstrual syndrome, just before their menstruations.
Okay.
And it has been very disturbing for most of the girls. Important to mention that it's not every girl who is going to experience premenstrual syndrome.
Okay.
But we have a percentage that experience it. Some have it in a very mild form. Others have it moderately. And a smaller number of about 3% will have it in a very severe form.
All right.
Yes.
So there's variation.
There's variations.
It varies.
It varies. But some of the symptoms that they're likely to experience is that they're likely to have even some headaches, abdominal discomfort and bloatness. They get into emotional burnout.
Emotional burnout. And this is before they receive
before they receive their menses. Yes.
Okay.
When it comes in the second half of the cycle.
Second half.
And especially the last 7 days. So you find they're quite irritable, annoyed on very small matters. Yes.
There's
And the worst thing again that happens is that they lose energy.
Okay.
Yes.
They lose energy for...
You feel so out of energy.
All right. They are lethargic, basically.
They are lethargic.
For basic...
You find you're doing your things because you have to do.
And these are the
Their
normal things that
cycle
they do.
there. Yes.
They
And
are
they're the normal things.
They are the
they
normal
do.
things that they do.
Yes.
Okay.
Yes. So those who experience very severe forms may even have now the headaches. Some may even have diarrhea in very severe forms.
All right.
Yes.
So what is the message you are passing through when you say, there's this premenstrual syndrome that is coming,
Yes.
and which is experienced not by everyone. So what is the message that you're passing? Is this something that should cause someone to be worried, seek medical advice, or what do you say about it?
It should not be worried.
Okay.
But again,
All
as a
right.
client,
Yes.
you'll always be worried.
Okay.
And the worst thing is that when you don't know what is happening to you, you don't know how to handle it.
Yes.
But when this parent understands and they observe, because they get a lot of troubles with the parents because they are thinking they are refusing to work. They tell you they have nasikia tumbo vibaya, you're thinking they are pretending.
You left utensils to be washed, to be cleaned, they are not clean.
You come and they are trying to clean them. We are not excusing them for laziness.
Okay.
But again, it's good for a parent to understand.
understand.
If this is the same child you left your work with last week and
Yes.
all that, and they did
Yes.
it very well,
Yes.
then this particular time there's something, then you can observe it almost become like a cycle.
All right. At
It's-
a particular
it's
time,
at times,
yes,
yes.
that this is actually happening.
Something is happening, yeah? So when they understand themselves what is happening to them, it's much easier to handle. And maybe even those who are with them, when they observe those kind of changes, then they're likely to be, because again, we have said they get irritable.
Okay.
So it becomes very hard to sort issues.
All right.
Yes.
Wow.
Yeah.
Are there probably, before we go, to other, primary things that we could handle? Our viewers, just in case you're joining us, this is menstrual health that we have a discussion on. Well, not quite a common topic, probably, but we are happy that we're able to have our guests tonight, and I hope you're getting, blessed in this sense, and also getting information, and we are moving somewhere as we go along with the discussion. We see there's a number that's going down there. You can use it, to send us your comment, also to send us your question, and we're happy and we are glad. If you can be able to share this also to, your friends, of your age mates, we say this is a program that is going to, or probably also a show that is cutting across. We are addressing issues that are going on through mothers and fathers, through young girls and also young boys. This is of great importance and great help. Kindly share and become also a blessing to someone else. Yes, in the name of Jesus. let's go back to, to this particular discussion. You talked of PMS. Probably we can bring in some others. What are some of the other things that also happen, along? I've been able to see that these are symptoms that do occur and these are normal things. What are other things that you probably want to bring in?
Before even you leave there, I would say if they are too severe,
yes,
somebody should not just suffer.
Okay.
They can be assisted.
So you don't just, persevere.
You're not just telling them, just understand.
Just understand.
No, if
bear
you're
with
in the
situation.
severe class,
you are a woman. Bear with the situation.
No, if you're in the severe class,
yes.
then something can also be done to assist you. And the other thing that also happens is what we call dysmenorrhea, which is painful menstruation.
Painful menstruation, yes.
Yes. So the painful menstruations happen, and most of the girls will experience that. And again, depends with the individuals. There are some, their periods are not painful ever since they've started. Others, they have been painful.
Yes.
The severity again is individualized. There are some who are going to have mild pains. There are some who are going to have severe or moderate. The ones who have severe, they will come also associated with other symptoms. Apart from just abdominal pains, they have headache, they have diarrhea. And of course, you can imagine that one girl who has that severe symptoms, what happens to them? They cannot even attend classes. They cannot be able to do much. So a lot of their time is lost.
It's lost to that.
Yes.
How do you want to suggest that they can get help?
One, I would say the first thing is when I understand what is happening to me.
Exactly.
That is a first treatment.
Understand what is happening.
Understand what is happening to you. So when they understand this pain comes with periods and it is not out of sickness. If it is mild, they are okay to bear.
To bear with it.
To bear with it. If it is moderate and it's affecting their activities, then they can be put on some treatments. There are treatments that are available. Because again, you don't have to suffer. Your other environmental issues should not suffer just because of a physiological process.
Just because of physiological process.
Because if you can manage your pain and you're able to attend your classes,
then we need to do that.
Then we need to do that.
We need to solve that particular problem.
We need to solve that, yes. So that happens, and when they understand that it is physiological, and if you allow me at this point, I would also want to put it across, because we have had many girls advised and told that this one, the only treatment you have is sexual intercourse.
Wow. I think our viewers will probably want to, just address them, because that's a very important point. We're just coming more or less to the close of the show.
Yes.
But just bring on that point even to the caregivers, the mothers. Yes, that will be important.
Yes. So the pain should be considered physiological.
Yes.
And we have other ways of managing. And we have women who are even having 3 children to date.
Yes.
And they still experience menstrual pain.
Pain and cramping.
Yes. Okay.
Yes.
So I believe this is quite misguiding when you tell this young person, like when you have sexual intercourse, the pain will go.
The pain will go.
Because they are the prostaglandins that are produced by the body, and sex will not stop prostaglandins. Me and you, we know.
We know that, and we're actually putting these girls at a risk.
At a risk
of, because
exposing to them to early sexual exposure in the name of managing the menstrual pain. Yes.
Managing the
Others
pain.
are told when you give birth, after they have intercourse and the pain has not gone, now they are told, no, yours can only be cleared by
by giving birth.
By giving birth.
All right.
There are some that reduces once they give birth, yes, but not everyone. Not everyone.
All right.
So don't compromise your life. Just come, we give you medication.
The risk is actually higher of getting other things.
Other than
the early pregnancies, from contracting HIV and other STIs. Probably before we, just coming almost to a close of this show.
Yes.
Is there just one more that you want to mention, just very briefly? Yeah, to the viewer. Any other primary abnormality that you think would also occur?
I think mainly what we mentioned in terms of the primary.
All right.
In the absence.
Yes.
So if you have been having your periods and again you miss them, of course the first thing is when you miss your periods, the first common things occur more commonly.
Yes.
We think about a pregnancy.
We think about a pregnancy.
Yes. But if it's in the absence of a pregnancy again,
yes,
don't worry.
Yes.
Just come to us and we're going to guide you and you're going to find out what could be the problem. But again, remember what I said. For the young ones, especially when their periods start,
Yes.
most of them are not regular.
They are not very regular.
They are not regular.
Yes.
Yes. And again, and some may take quite a while. I said 2 to 3 years. I mean, 1 to 2 years, but there are some who can take even quite a while before their menses also regulate and have a sequence pattern.
All right.
Yes.
Wow, that's good.
Yes.
Our viewers, we know we're just coming almost to a close of this, and I want to believe that this is, useful and is becoming useful as we move along. I would want probably our guests to bring in a parting shot, and what's the message you want to leave our viewers with? Could be the young girls, could be the families. What's the message you want to incorporate? I know this is huge, and
Yes, it's huge, yeah.
we need quite some time to discuss this and really do good justice on it.
Yes.
But I want to believe that this, our viewers is, benefiting all of us. So we will look at these at the things we can do practically and of public health importance. So what is probably the message you can leave our viewers with tonight as we just come into the close of this show?
What I would say is, let us not shy from talking about menstruation, because it is a physiological process in the body, just like the way you eat your food and everything. This is a process that happens. When we don't shy talking about it, even in the family, then we'll be able to support our girls, even when they are going through what they are going through, and much more, the provision of the supports. Because I know it has even come to the media previously, where you find there are girls who are not even able to access the sanitary towels, and for them to be able to have a good hygiene of a menstruation, then they require the sanitary towels. So let's not just look at like for those girls, yes, there, let us support them. That support will be very necessary, and especially when it's come to, and of course, let the parents talk to them, the teachers will talk to them, let us all talk to them, because they don't know about it. They are going to hear, then they start experiencing. Then they need to be told, how do I handle myself when I'm having my menstruations? So that again, you don't mess yourself. You don't go to a bus and you wake up and you can't get out of that bus. Yes, we need to support them with education.
Thank you so much, Dr. for having us. Having time to join us, this evening for this particular show. Thank you very much, viewers, for this engagement. I believe this show has, been beneficial to all of us as we continue on to engage. And we look forward for more. Let's, try to implement, and indeed it's really possible for us to implement some of these things that we're discussing and to better our lives through this. So keep it elevated, don't touch that dial. Until we meet again, we are grateful that you joined us this evening. Bye-bye. Next time.